My name is Dr. Mark Lubitz, DMD, and I work at Towne Centre Family Dental in Hillsborough, New Jersey. My education, I grew up in New Jersey, went to Monmouth University years ago, then I graduated and I went to University of Medicine and Dentistry in New Jersey. And I had my own private practice for about 20 years up in Belle Meade till I joined this practice in 2018. I was talking to Dr. Al one day, we had a little conversation, and he said, why don't you come over here and I'll buy you out. So it seemed like the timing was right, so that's what I did. And also when I came over here, he has a lot of very advanced dental equipment that I didn't have in my office, such as like 3D scanners and cone beams and whatnot. And I got big into doing implant dentistry, so this place really kind of helped me along with that. I was kind of moving along in my career and I wanted to do some more advanced things, so this was a big benefit to me. It's changed everything from A to Z. I mean, from when I got out of school to the things that we have now, I couldn't even imagine. It's just kind of like imagining the world before the iPhone. I mean, it's just changed everything, and it's true in dentistry. I mean, we have things now, we have literally like a CAT scan, so we can see three-dimensional viewings of your jaw structure if we're going to do dental implants. We don't use like the gooky dental impression material much anymore. That's all digitally done. Everything can be put onto a computer. You can look at it anywhere in the world. You can treat and plan a lot easier now. It's just these tools just make life a lot easier and a lot more accurate. I have a device that allows me to fabricate restorations right in the office that we used to have to send to a dental lab. It's like a CAD/CAM process, and we used to have to take an impression and make a temporary, and the patient had to come back in 2 weeks wearing a temporary that would come out sometimes. You'd have to renumb them to put the restoration in. Now it's all done in one visit in a matter of 2 hours time. I can scan them, design the restoration right here, make it right in the office. It has a beautiful fit, and they're done with one day. And people like that much better. It's a lot less hassle for them. Best part, like I guess you probably heard this before, but I do like helping patients. I try to listen to what they need. I kind of follow the golden rule, like I wouldn't do anything on them that I wouldn't want done on myself. You know, I try to keep the costs as reasonable as I can for people and try to get them through. Sometimes they're in a bad place in life, try to get them through that a little bit. Everybody here is just very nice, very knowledgeable. It's nice working with other dentists because I used to just work by myself, and it's just nice to be able to consult with other people in the same field. It just makes life a lot easier. You get better treatment outcomes. You see things from a different point of view that you're not normally would see. Day to day, it could be anything. It could be simple, just doing fillings or operative dentistry, to, you know, full mouth extractions and placing dental implants and putting in somebody's teeth that haven't had a decent set of teeth for half their life. And it's just an amazing feeling when that all goes. You know, it could be anything from a simple, I'm afraid of the dentist, and you just treat somebody really nice and you can change their whole attitude about coming to the dentist, because a lot of them just had bad experiences when they were a kid. And if you can just get them through that for the rest of their lives, they won't be afraid to have dental work done, which can really save them a lot of issues as they get older. The main thing is you look at them eye to eye. You don't sit them back in the chair. You kind of sit in front of them, try to talk to them, get a feel for where they're coming from, ask them about their past. I always ask them like what they do for a living, kind of break the ice a little bit and talk about non-dental things to them. You just want to kind of get a feel for how they're thinking and where they're at that point in time. How do I make sure he's cared for? Well, you have to do everything properly. You have to get proper records, x-rays, you have to talk to the patient, you have to take a lot of photographs, you have to check their medical histories because that has a big outcome difference on different procedures. You just have to make sure all your ducks are in a row before you actually start treating somebody. I've been in bands since I was in high school, played keyboards and guitar, and I just really never put it down to this day, you know, many years later. And, you know, to this day, you know, we still go to a studio once a week and we practice and we do gigs and whatnot, and it's just totally different from this thing, but it's just a nice hobby. It really is. It just breaks up things for me a little bit.